Good morning, and welcome to our press briefing with updates on COVID-19. I'd like to ask you to join me for a moment of silence for the lives we've lost to COVID-19 and for the lives they leave behind. Thank you. And now we'll hear updates from our community leaders. And first, we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. Good morning. As I discussed last week, there are three thresholds for determining or for evaluating the spread of the virus in the community. Two of those are the census of the local hospitals, and another is the positivity rate. As I indicated last week, the models that they use at Phoebe Putney indicated that we had seen the top of this recent surge, and pursuant to that and consistent with those models, the census at Phoebe last week, average census was 108. This week we learned it was down to 105 and is declining. There was one day when there were 13 discharges against only 5 admissions. In 3 weeks, the positivity rate in Dougherty County has fallen from 19% to 14%. And these are favorable trends. I think what we are seeing is the conclusion of the surge following the holidays. Unfortunately, there are still numerous people on ventilators at the hospital. We had people who became seriously ill as a result to the increased spread of the virus. The numbers, the positivity rates, I mentioned that there are some inconsistencies between the reports we get from the city manager and what's listed on the Department of Public Health website. The numbers from the city manager are more accurate because the city staff is obtaining reports from the private clinics, private practices that are doing testing, which are sometimes slow to send those reports to the Department of Public Health, and that includes Albany Internal Medicine, Albany Area Primary Health Care, Veranda, and one source in addition to the Health Department and Phoebe Putney. One thing we're going to talk about today, other speakers, everyone who's had the vaccine at Phoebe and the Health Department seem to report that it's been a pleasant experience. I mean, as pleasant as can be. There's no long waits. Dr. Black will speak to that. I was on a conference call earlier this week when Dr. Black was addressing some of the misinformation that's out there about the vaccine. But finally, after this long ordeal, we have the opportunity to protect ourselves and protect others. And we want to encourage everyone to have the vaccine. We have the numbers. If you want to go to the Health Department, if you want to go to Phoebe, also Albany Area Primary Health Care is vaccinating, and there may be other options in the coming months. You can just call the numbers that will be provided to schedule an appointment. I think Department of Public Health, Dr. Lewis said earlier this week, it's a 2 or 3 day wait, and at Phoebe, sometimes you can get in the next day depending on what the schedule is. With that, just in closing, remember, wear a mask, wash your hands, and watch your distance. Thank you.
Thank you, Mr. Mayor, for your comments this morning. Now I'd like to move to bring up Dougherty County Commission Chair Christopher Cohilas.
Thank you, Chief. Thank you, Mayor. Good morning, everyone. Today, I'm going to spend a fair amount of time emphasizing facts and just delivering as much information as I can. As the Mayor correctly pointed out, we are seeing a downward trend here in Albany and in Daugherty County. Our numbers, which were at 19%, are now hovering at around 14% of the number of people or percentage of people that are being tested actually testing positive. So you think about that for a second. Those are the people that are being tested or they're going to the hospital and are automatically getting tested, and it's a much lower percentage rate. Additionally, another data point, the city's done a great job, and it's an out-of-the-box way of gathering data. We actually test the stormwater here in our community to establish what levels of the virus are in the stormwater. And so we have a benchmark from back in March and April of 2020, and we had our stormwater then was tested, and it had a very high level of the presence of the virus. And so what we saw after the holidays was that stormwater was tested again, and the amount of the virus that was in the water was very close to what it was back in March and April. But now it's going down. So what does that mean? It's an indicator that it's less prevalent in the community. Why is that? Well, obviously we're seeing people return to more social distancing, less gathering, less large groups. We know that Thanksgiving and Christmas were natural opportunities for the virus to spread. And then secondarily, what we don't know is what is the impact of the fact that we have vaccinations that are actually coming into the community and people that are actually obtaining a medically delivered form of immunity. And that's very, very important. And I want to continue to applaud Phoebe Putney Memorial Hospital, the Department of Public Health, and our other Albany area primary health care, our other providers that are administering the vaccine. As of today, Phoebe has administered more than 20,000 vaccines here in our community. And I have to tell you, that is a tremendous asset for us. And it's not just folks that are in Daugherty County, it's folks from around the region, around the state that are coming to gain this resource, which we are very, very, very fortunate to have. And frankly, the fact that we have 3 different places that are capable of administering the vaccine, that have administered this many vaccines in this short a period of time, is remarkable. And I'm very, very thankful for that. I want to talk about, because there's a lot of information that's out on the internet, it's out on Facebook, out on Instagram. You know, I've said this time and time again. Please, making a decision about whether or not to get a vaccination is a personal decision. But I ask people, when you make your own personal decisions, please make sure that you're getting factual information from credible medical sources. And so what I've asked my staff to do is drill down into the information. Get me the CDC information. Get information from reliable sources. And we've understood that a lot of people in this community have gotten COVID-19. Some knew it, some didn't know it, some actually, or many overcame it, some didn't. But we do know the folks that got the virus obtained a level of immunity that exists for some period of time. I've asked question after question after question. How long does that immunity last? And there's no clearly defined answer. I've heard as much as or as little as 3 months, as much as 6 months. I'm not sure. But what the information is that I've received is that the COVID-19 vaccination is a safer way to build protection, and that getting the virus that causes COVID-19 may cause some protection known as an antibody or immunity, but experts don't know how long that protection actually lasts. Additionally, by getting the COVID-19 vaccination, what you do, as has been demonstrated by the statistics that we've seen, one, it's 95% effective. That's a very good thing, especially when you weigh the potential side effects versus the potential risk of severe illness or death. And that doesn't necessarily mean that it would happen to you, but it also means you're also helping yourself protect other people as well. And that's a very good thing. people who have gotten the virus before, this was an important question for me to have an answer to. Can they benefit from having the COVID-19 vaccination? The answer is yes, because according to what I understand, what I've been explained by the medical experts, is that it gives them a greater degree of immunity. And we don't know how long the immunity lasts by virtue of getting over the virus. So this is, if you think about it, it's like a booster shot. It's additional protection against this virus, which obviously has gripped this community and many, many others as well. I want to address a piece of misinformation. The vaccination does not give you COVID-19. That is an absolute falsehood. It does not give you COVID-19. And I've asked that question because I've heard it from many, many folks. And I understand where the question comes from. People, worry about vaccinations and they have different concerns. But I've asked that again and again and again, and resoundingly the answer has been no. The COVID-19 vaccination does not actually give you COVID-19. Additionally, the COVID-19 vaccine will not cause you to test positive on a COVID-19 test. So that's very important. What's really important, though, about the vaccination is that it's 95% effective in helping prevent you from getting sick from the virus itself. A lot of people have asked about how safe is this vaccine. It's been developed so quickly, and can we trust it? And I've asked a lot of these questions. I've had the same questions, and it's an intensely personal decision on whether or not to get vaccinated. And what I've drilled down into, and the answers I've gotten is that this vaccination went through the same safety standards as all other vaccines. And what I think we've seen here in this remarkably bizarre year with this pandemic is you've had the entire focus of the medical community on one issue. You've had a tremendous amount, millions and billions of dollars that have been spent on one subject. The focus of all of these medical doctors, researchers, scientists on one issue. And everything has been expedited, yes. But you also have the folks at the FDA that have been singularly focused on this one issue. And I've asked these doctors, I've talked to Dr. Black, I've talked to others, and it is understood and respected the process that this vaccine has gone through. And thus far, we're seeing good results. We haven't had anyone in our community that has reacted negatively during the administration of the test. And I'm not a doctor, and I can't give you a medical opinion. All I can deliver are the facts that I've gotten, and I've gone and asked hard questions so that I can deliver that information back to everyone else. Up until now, and I've said this before many times, before our only option was let's live sort of a bizarre and hermit-like existence where we have to stay away from each other. We can't commune the same way. We can't connect with each other in the same way. And now we are being offered some light at the end of the tunnel. I've said that this is a marathon and not a race. And I think that this is an incredibly valuable tool that we have here in our community. And everyone has to make their own personal decision. And I just ask everyone, please make that decision based on the information that's out there, but that's factual. When you want to get advice on how to build a building, you go to an architect. When you want to get medical advice, you go to a doctor. When you want to get legal advice, you go to a lawyer. Don't go to Facebook. Go to the CDC website. Talk to your doctor. Listen to the information that's going to be delivered by Dr. Black today, and then make your own personal decision on whether or not to get vaccinated. Again, we've already vaccinated over 20,000 people. It's happening every single day. It's a positive experience. We've got good results. I've said this before. We have an EMT every single day that goes over to Phoebe HealthWorks, and his job is to make sure that no one has a negative reaction that requires hospitalization. There's a 15-minute period that everyone has to sort of sit there and wait after they are administered the shot. And no one's had to be carried to the hospital as a result of getting the shot. And that's good information and a good signal that this is a good thing for our community. I want to deliver again how do I get the vaccine? Because we have a lot of people that want the vaccine. There's a tremendous demand for the vaccine. Current COVID vaccination sites for Dougherty County, Phoebe Putney, the phone number to schedule that, 229-312-1919, 229-312-1919. Additionally, the Dougherty County Health Department, 229-352-6567, 229-352-6567. Albany Area Primary Health Care at Phoebe East, 229-338-7589, 229-338-7589. Again, I'm very thankful for the opportunities that we have, the resources that we have, and frankly, had we not had so much collaboration, community support, tremendous support from the medical community, and so many folks pulling in one direction, I don't think we would be standing here today and saying that we had administered over 20,000 vaccines. Our community is getting healthier and stronger, and we need to continue to move in the right direction. Thank you.
Thank you, Mr. Chairman, for your comments today. I want to just take a point of personal privilege to thank Mayor Dorrell and Chairman Kohelis for your leadership. That doesn't get said enough. And I want to thank both of you for what you do. Continue to come to this microphone week after week, provide information to this community. When we say community leaders, the two of you, I applaud you for what you've done during this pandemic, and I think that needs to be said publicly. I want to bring up now a great partner in this effort to address the COVID-19 pandemic in our community. He's been here with us the whole way, and I'd like to bring up now Dr. James Black, who is the chairman of the emergency department at Phoebe Putney Memorial Hospital, for an update. Dr. Black.
Good morning. Thank you again for having us up here. I often feel like I need to call the chairman and the mayor, Dr. Kohelis and Dr. Dorrell, as they have done a remarkable job in gaining a really in-depth understanding of what we're facing here, not from just the way it faces us from the civic responsibility they have, but they have tried to understand our challenges. And I tell you, it has been nothing short of remarkable what they've been able to do, not only with our community, but in forging a relationship with the state and with the governor's office to get us a lot of the supplies and resources we need. So that is no small effort on their part, and we do really appreciate it. You're going to hear me echo a lot of the things that you've heard, because you can't hear it enough. I think we'll start with our numbers, and if you look at the little mountain peak up in the upper left, it shows that our numbers, that the numbers are slightly leveling off and even coming down a little bit. And today we had a total of 104 as of this morning, COVID patients in our hospitals, 86 in Albany and 18, I believe, over in Sumter. And those numbers are down sharply from last week, which is a good sign for us. We've seen that we're at least hopeful that this is signaling the end of the peak that we saw as a result of the winter holidays. And, we had return to school, followed by Thanksgiving, followed by Christmas, followed by New Year's celebrations. And I think people had a little bit of a hard time resisting the urge to get together, and result as a peak, not just locally, but nationwide. So we're starting to see a little bit of a downturn, but this is absolutely no time for us to let our guard down. And I know that everybody is looking forward to the Super Bowl. All right, let me go ahead and spoil it for you. Kansas City is going to win, and so no need for you guys to get together and have a large party. I'll make some alternative plans, and a lot of my friends and I, we're going to get on a big Zoom call, and we're going to watch it together separately from our own locations, but we're going to have a Super Bowl party separate at everyone's house on Zoom. So find some creative ways, avoid those large gatherings. I want to caution us, we've made some significant headways, but again, we're expecting this to be another bump and another bump up, so let's do what we can. As the mayor and the chairman have noted, we've given over 20,000 vaccinations, and it has gone not without a lot of planning, but certainly has gone as well as we could have expected. And we are kind of somewhat of the envy of a lot of people in the state, and this has resulted in people coming down from various parts of the states and also calling from other states, hoping to come over here and get the vaccination. And as much as we'd like to try to help everyone, you know, our responsibility is to our citizens in this part of the country. So we've had to put some limitations on who can get the vaccinations, and they have to be for one of the zip codes that we actually is part of our service areas. So we're doing what we can to protect our people, but we're giving out tons of vaccinations. As such, we're requesting tons of vaccinations from the state, who in turn get those from the United States government. So we don't always get what we request, but we request a bunch, and we're giving out all that we get. But it's going to be a constant, I guess, a constantly changing landscape, and we'll be making changes to our vaccination protocols and how many people we can do at a certain amount of time based on the amount of supply that we have. But we are not saving any vaccinations. We're using them all up, and we're using them as many as we can get, and we're ordering as many we can get. So be aware of that. Be mindful of that. I told you I would give an update. I think I'm 5+ weeks out from getting my first vaccination and a couple weeks out from my second, and I'm still upright. My biggest endorsement, I get lots of questions, is that my mother and my sister have both gotten vaccinated, and those of you who know me, they're no more important people to me in the world, and I would not have suggested it if I was not really confident in the safety and also the efficacy of getting the vaccine. And I would hate to think that we had something that was available to us to help us fight coronavirus and fight the spread that we did not take advantage of. So if you're one of the eligible groups, and right now, we're following the CDC and the state guidelines, healthcare employees, the elderly population, those caregivers, and our first responders and pre-hospital personnel are the ones that are now eligible to get the vaccine. But as that list is expanded, we will expand according to the state and the federal guidelines. Although we're doing, we hope that we've kind of crested that peak and seeing the numbers come down, it is somewhat solemn to note that yesterday, 5,116 people died from coronavirus, a new high, okay? So it is not going away. It has not gone away. We're going to continue to do everything we can, and this community should continue to do everything we can. That we've been fighting this as early as anybody else around the country has, and we know the things that we have to do in order to keep pushing those numbers down. Wear your face mask properly, social distancing, wash your hands frequently, avoiding large gatherings. I will answer one of the questions that I've been asked. The new popular question is, should I wear 2 face masks? Let me put it to you this way. We don't have any evidence longitudinally that shows that it does or how much it will help, but it stands to reason that it will help. But I will tell you, wearing 2 masks improperly is not better than wearing 1 mask properly. So if you have 1 mask under your chin and one of your mouth with your nose exposed, you aren't doing any good, okay? Wear 2 masks, but wear them properly if you're so inclined. I also would like to tell you that if you're probably gonna wear 2 masks, they probably should be 2 different type of masks if you're gonna get the maximum benefit. But if you have a properly fitting N95 mask, there is not much more that you're gonna gain. Alternatively, the only other problem I see with wearing 2 masks is the discomfort that you feel and the desire to want to keep adjusting those masks on your face, resulting in you touching yourself more than you would now. So just be aware that those are some of the pitfalls. If you want to wear 2 masks, put them on, fit them properly, and don't touch them until you're ready to remove them. And again, no substitute for wearing a mask properly, all right? And the other thing is getting vaccinated, as you've heard Dr. Kohelis say earlier, getting the vaccine is not a substitute for any of the other safe practices that we have. You don't get the vaccine and all of a sudden you can toss your mask and start washing your hands and start kissing and loving on everybody, all right? The vaccine is not totally protective, it's not the be-all, end-all, but it certainly will reduce your risk of getting the virus. And if you do get the virus, it will reduce the severity of your symptoms. Okay, so those, I just want us to have some realistic expectations. All right, thank you very much. Appreciate it.
Thank you, Dr. Black, for your comments today. If you'll notice how the press conferences have been arranged, we have comments from our elected officials. We have great partnerships from our medical community. Dr. Black has certainly been a part of that, and Phoebe Putney Memorial Hospital will appreciate that. And another great partner of ours is Public Health. And now we'll receive our report from Dr. Charles Lewis, who is the director of the Southwest Georgia Health District.
Thank you, Chief. Okay, the first thing I want to talk about is some of the good news, and this really parallels what has already been said. I would like to say that in public health, we have a reporting system so that no matter where a Daugherty County citizen is tested, whether it's in Daugherty County, Tift County, Fulton County, those results will be reported to the state, and ultimately here in Daugherty County, our epidemiologists will know about it. So our numbers reflect all Daugherty County residents, no matter where the test was performed. And so looking at our graph here, particularly the one on the upper left corner shows the new cases among Daugherty County citizens. And it's easy to see the three humps. The first one was back in the spring. Things got better in June, and then July came along. In August, we had another hump, got better by September and October. And then we had this terrible hump that started in late November and stuck with us through December. And somewhere around the last couple of days of December or the first few days of January, the numbers of new cases started to go down. We didn't talk a lot about it for a week or so because we wanted to wait and see if it was real. And sure enough, throughout the month of January, the numbers of new cases went down. Now, this slide is reflective of the entire Southwest Georgia district. My apologies, this is the 14 county district, but you'll see that this pretty much parallels Daugherty County in just a minute. Okay, so Daugherty County is being shown now. And one difference, if you can remember the previous slide, the springtime hump, that first surge for Daugherty County was worse than the district in general. It was worse than almost any place in the nation, actually. But you see the three different surges, and we right now are enjoying fewer numbers of new cases compared to early January. If you look at the first day of February, the number of new cases has gone down by over 30%. So that is actually great news, something to celebrate. But the sort of the reality of that is, though, that even though we've seen tremendous improvement, the amount of spread in the community is still very high. It is still not time to let your guard down. In spite of this good news, there's danger in the community. If you go away from your home and if you get within 6 feet of other people without wearing a mask, you're in danger of becoming sick. If you have the virus, you're in danger of spreading it. So we need to realize that we're not at the end of this pandemic, not by a long shot. So one thing that we can do is if we are eligible, we can get the vaccine series. Currently, we have the 2-shot series. The Pfizer product is given on 21 days apart. The Moderna product is generally given on 28 days apart. Please don't fret if you get the first vaccine and if your second dose can't be done exactly on the same day. It's okay if it happens to be a day or so early, or if it's up to 2 weeks late, but we will continue to shoot for those intervals of 21 days for Pfizer and 28 days for Moderna. And bear in mind, when you get your vaccine, you're helping yourself, you're helping your family, and you're helping the community. Of course, when you get vaccinated, we know that there's a 95% chance that you're going to be immune to COVID. Furthermore, every time another person gets vaccinated in the community, we get closer and closer to herd immunity. We haven't talked about that in a while, so just to review, what we're talking about is a condition where a sufficient number of members of the community are immune to a germ. Therefore, the germ has a reduced number of options to move to basically stay alive. We don't know exactly how many people need to be immune in the community to control the COVID virus. For some viruses, it's as low as 60 or 70%. We don't know exactly for COVID, but we do know that we're not there yet, and the more people who survive an infection and the more people who get immunized, the closer we get to herd immunity, and at that point, the virus simply won't have places to go. Once it's inside of the body of a host, it's only got a certain number of days to skip over to another person. And if it does not do that, then that virus will not replicate, it won't pass on, it'll come to an end. So we're getting there closer and closer every day. In the Southwest Georgia Health District, which is comprised of 14 counties, Public Health has administered somewhere around 18,000 doses of the COVID-19 vaccine. In Dougherty County, the Dougherty County Public Health Department has administered over 2,500 doses of vaccines. We are sharing some of our nurses with Phoebe. 2 days a week, we're sending nurses over to the vaccination clinic. We are pleased to be able to do that. It's a great resource for the community. And frankly, we don't exactly care where you get your vaccine. The main thing is that you get it, and we're very fortunate here that we have quite a number of places where people can go. In Dougherty County, the vaccine is sufficiently plentiful. There may be days or locations where the inventory may get down a little low, but we have not run out here in Dougherty County. And as Chairman Cohilas pointed out earlier, you can call to schedule an appointment for a vaccine at the Dougherty County Health Department on South Slappy. It is vital that you call and make this appointment. We do not want people showing up without an appointment to get a vaccine. And the best way to do that is to call the following number, 229-352-6567, and that will connect you with our call center. We have usually about 10 operators on duty Monday through Friday. We have a smaller number on Saturday, but you can make that appointment. Typically, we are booked up 24 to 48 hours in advance. If you call today, we have appointments available for this coming Monday. So you don't have to wait very long for your appointment. When you call, it is true that sometimes we have high call volumes. On average, the waiting time once you call is less than 2.5 minutes. So if you'll be just a bit patient, your call will be received and you can make an appointment for the vaccine. We do believe that the vaccine is safe and effective. Millions of doses have been administered in the United States. There have been very few serious side effects The risk of a serious side effects from the vaccine is very small compared to the risk of having bad outcomes or even death from the infection. In keeping with Dr. Black's comments, I have had the vaccine series, the first and second shot. I had some mild problems. I've recommended the vaccine to family members and to friends. Would like to show a slide that lists the eligibility. I think we've got it here. So it's primarily the CDC that determines who is eligible for the vaccine at any given time. Now, each state does have a little bit of wiggle room, a little bit of autonomy to tweak the plan somewhat. So if you compare the state of Georgia with surrounding states, you may find some subtle differences in the plan. For the state of Georgia, we're in phase 1A, which includes healthcare workers, people who live in long-term care facilities, adults age 65 and older, and those who legitimately provide care to adults 65 and older. It's available for law enforcement members, for firefighters, and for 911 operators and dispatchers. The vaccine is free. In some situations, if a person is insured, the provider of the vaccine may elect to bill the insurance company for an administrative fee, but there will be no out-of-pocket cost to the patient. I want to talk some about testing. Testing is still very important, particularly for those folks who exhibit signs and symptoms of COVID-19. We're particularly concerned about people with cough, fever, shortness of breath, sore throat, body aches, new loss of the sense of taste and smell. If you have any of those symptoms, it could very well be COVID. We want you to stay home. Please don't go out in the community until COVID has been ruled out. You should consult your primary health care provider. Ask if testing is appropriate for you. Testing is still free of charge through public health. It's relatively easy to do. We have a slide here that provides information for testing outside of Dougherty County. If you want to be tested outside of Dougherty County, there are a couple of options. You can call that same number that I just mentioned, 229-352-6567, and you can schedule an appointment for a test outside of Dougherty County. Or you can go online 24 hours a day at covid19.dph.ga.gov, and you can see for yourself the locations that we have and select an appointment time that would work well for you. In Dougherty County, we have a special situation. There's a company that we have partnered with called Mako, and in partnership with the Dougherty County Exchange Club Fairground, Mako is at the fairground 6 days a week, Monday through Saturday. They are doing free COVID tests, and to go to get a test, you need to pre-register. And one way to pre-register is by using the QR code that you see here on the screen. The QR code is available on the website for public health in Southwest Georgia. You could go to Southwest Georgia Public Health, and it will take you to our website, and this QR code is there. You can easily scan that, and you can make your own, you can register by yourself in about 2 minutes. You don't exactly make an appointment to get tested at the fairground. You just register, and then you can go at any time that they're open, which is 9 to 4 on Monday through Friday, and I believe 9 to 1 on Saturday. There's also a website. It's a rather long. You can find this website address for MACO on Public Health's website. Again, Public Health of Southwest Georgia, and you'll see this MACO advertisement. We urge you to consider getting tested there. Again, it's free. They will ask you if you have insurance, and again, it's only because they will bill your insurance company if you have insurance, but they will not bill you. It's free. I'd like to also tag team with Dr. Black and mention the Super Bowl. It's a time-honored tradition that people get together and watch the big sporting events, and very few are bigger than the Super Bowl. And that's fine if you want to watch it. Make sure you're safe. The best way to do that is to stay home and watch it just with those people with whom you live. If you insist on getting together with other people, please consider doing so safely. If you gather with other people from outside your household, please do so outdoors. Stay 6 feet apart. Wear masks. Taking your own food and beverage is safer than sharing food. Frequent washing of hands and cleansing of commonly touched surfaces would help as well. So things are better in Southwest Georgia. They're better throughout the state as far as new cases. The vaccine is available to those who have been deemed eligible. Testing is available. And we all know those things that we've been asked to do throughout the pandemic that really do make a difference. So if we'll make the wise choices, we can control this virus in time. Thank you, and if you have questions, please call Public Health. We'll be happy to try to help you.
Thank you, Dr. Ruiz, for your comments today. Usually we finish with the coroner. But today we have 2 more speakers today, and so don't leave until we finish up today. And of course, we'll have an opportunity for questions at the end today. But I'd like to bring up now Dougherty County Coroner, Mr. Michael Fowler.
Most people would be saying that I'm the last one you want to see, coming to your family house or coming to the hospital. But I've heard different presentation. Things seem to be getting better, but looking at the death rate, it's getting worse for me. Right now, we at 257 cases of residents that died of Dougherty County. In the last 7 days, we had 11 deaths here in Dougherty County. In the last 15 days, we had 22 deaths that died here in Dougherty County. And you can see where most of the hidden at. We have 61 whites, 3 Latino, 2 Asian, 191 blacks. It's hitting the females a little bit harder than the males. We have 138 females. We have 119 males. Then you kind of see the breakdown of it. We have 2 Asian female, 1 Latino female, 2 Latino males, 35 white females, 26 white males. We have 90 black males. We have 101 black females. The average number of most of the deaths happening is in the age of 60. Age of 20, we have 2 deaths. We have 5 deaths in the age of 30, 14 deaths in the age of 40, 20 deaths in the age of 50, 72 deaths in the age of 60, 59 deaths in the age of 70, 57 deaths in the age of 80, and 25 in the age of 90, and over 100, we have 3 deaths. Again, I like to look at the month sometime. January we wind up with 38 deaths, similar to what we had in March when we first started out. In March, we had 39 deaths. So in January, after the holidays, we had 38 deaths. In February, we've already had 5 deaths. On the way over here, I got another call and stopped. We had another COVID death. So I'm going to have to add that number to it. So I don't know how many more deaths we're going to get between here and next week. But like I said, the death rate is on the rise. As everyone have said earlier, the correct way to wearing the mask is not on your chin, not with your nose out, because the virus is going to inhale, come through your nose. You got to wear your mask right. If you're wearing it on your, or just on your mouth and your chin, you might as well take it off, because you can inhale and exhale. You have a choice whether to wear a mask or you can wind up on the ventilator. And on the ventilator, they're going to put all these tubes in you. You're on the machine, IVs. So you decide. Is it simple just go and wear a mask, or whether do I wind up taking a chance playing Russian roulette? I might wind up on the ventilator by getting this virus. Vaccine, I encourage people to get the vaccine. I've gotten it. You can get the vaccine now, or you can take a chance playing Russian roulette again. If I don't get the vaccine, some kind of protection, I can wind up with all kinds of tubes running in me in the MICU unit or in the hospital. They have all these tubes running you. Sometimes you swell, and sometimes when you come die or go, you don't even look like yourself. You swell up and all this. So it's simple to just take the vaccine. That's a simple way of doing it. I can say it. It's my neighborhood. I'm black. I'm Black American. It's hitting our community harder than hitting other communities. I showed you a few minutes ago the population. It hit 191 blacks. So I can say it. We must do something. As they said earlier, we listen to everything else, but we don't have the facts. As the chairman said, you need to talk to the doctor. You need to look at the Department of Public Health and get the right information. Some people say, I'm not going to take the vaccine because they're going to put the virus in my system or whatever. But that is not true fact. But I'm going to do whatever I possibly can to not get the virus. If it takes me wearing 2 masks, so be it. I haven't gotten the virus. And my family haven't gotten it. My personal family, immediate family haven't gotten the virus because we're doing everything we possibly can. So it must be working. Somebody said, I can't wear a mask because I can't hardly breathe. Well, if they put you on the ventilator, you can't hardly breathe either. So you decide what you want to do. It's hitting our community. Our community one saying that I'm not going to take the vaccine. I'm not going to do it. Well, that's a choice you make. And that's a chance that I may be coming to your residence. I'm again say, you got to mask up. You got to take the vaccine if you want to. It's your choice. But like I said, we see the community that is hitting harder. We see that. I ain't got to spell it out. You look at the numbers. Our community, we got to wisen up and do whatever it takes to save our community. Thank you.
Thank you, Coroner Fowler, for your remarks today. We had a meeting earlier this week on Wednesday with our faith-based community, and as a result of that meeting, we are very fortunate today to have with us to finish out our press conference today, Bishop Frederick Williams of Gethsemane Worship Center. Bishop Williams, I'd like to bring you up for some remarks, please.
Thank you, and good morning. Just want to drop a few words of encouragement. As you know, when Corona came to this community, our church was the church that was highly impacted by it. In a matter of days, I had 40 people sick, 20 on ventilators, and 10 passed. It was devastating. It was new to us, but we got through it. I myself was positive for COVID, as well as my wife, 4 of my children, and their spouses, all at the same time. This prompted us to really seek more education about how this worked. Fortunately, all of us lived through it. And I'm here to strongly encourage you to consider the vaccine. As our coroner just said, speaking from the African American community, we are more likely to have serious complications from this and death. One of the things that I pride myself on advising people on is facts. And so what I would like for our community to do is get the facts. Read it, examine it, know it for yourself, and make an intelligent decision on whether or not you will be vaccinated. There is a passage of scripture I love to use, is that the people perish for a lack of knowledge. Well, you're getting great knowledge and a lot of it. So examine the information. If all lies in you to believe it, I strongly encourage you to take it. My mother's 88 years old. She took it. She's doing fine. She came through it fine. My sisters, I'm the baby of the group. So I've seen firsthand, good decisions brings life. And so I just want to encourage all of you, don't take other people's word for it, but when you read the facts and you really get the information you need, you can make an intelligent decision. But I want to say it again, I strongly encourage you to get the vaccine. Thank you.
Thank you, Bishop Williams, for your remarks, and let's all heed his comments today. We'd like to pause now for any questions from the media, from our social media as well. Ms. Howell? Okay. Yes. I've been asked to repeat questions that are provided when we have them, and the question is, after an individual has been positive for COVID-19, how long do they have to wait until they're able to receive the vaccine? Is it 30, 60, or 90 days? And I'd like to ask Dr. Ruiz to come up and address that question.
Thank you for that question. That is a good one. It's one that comes up fairly often. If we're talking about how long you have to wait, literally you have to wait until your isolation period is over with. For most people who have the COVID infection, the isolation period is 10 days beyond the first positive test, or 10 days beyond the first appearance of COVID symptoms, whichever one of those comes first. But generally, it's 10 days. There are some circumstances where the isolation period extends 20 days if someone has a very severe case of COVID, for instance, if they're hospitalized, treated with supplemental oxygen, or if they have a profound compromised immune system, the isolation period would be 20 days. So you have to wait until your isolation period is over. At that point, it would be okay for a COVID survivor to go ahead and begin the vaccine series. And it is advisable at this point in time for anyone who is in the eligibility criteria to get vaccinated, even if you have survived a COVID infection. Down the road, as more research is done, and I'm talking about probably years down the road, we may learn that getting vaccinated might not be necessary, but we're not at that point yet. We don't know. So the experts tell us that even if you have survived a COVID infection, it's wise to get vaccinated when you fit into the eligibility criteria. It is commonly accepted that once you have survived COVID, you are not likely to get it again for 6 months. It is true that there are rare occurrences where a person has gotten COVID for the second time within 6 months, but we're talking about very rare situations. If we shorten that to a 90-day period, it is very hard to find anyone who has had a second COVID infection within 90 days. So if you have had the COVID infection, if you are within the eligibility criteria, you have to wait until your isolation period is over. And by 90 days, you would want to be vaccinated again. So that leaves a window of somewhere between 10 days after the infection and 90 days. It's kind of a long-winded answer, but Mr. Fowler, is that okay? No, sir. They need to wait till the isolation period is over, which usually is 10 days. They are probably going to be immune for the full 90 days. After 90 days, the chance of a reinfection starts to go up. So between 10 days and 90 days, that would be a window that it would be a good idea to get vaccinated to be fully protected. But you definitely have to wait until your isolation period is over.
Any additional questions? Okay, we will then bring our press conference to an end for today. We'll see you here next week, next Friday at 10 a.m. Thank you and have a great day and a great weekend.